Governor, question for you. Dr. Fauci today, in his testimony at Congress, expressed concern about states and cities reopening too early. Last week, the Harvard survey identified 9 states that they said were ready to reopen. What are your concerns with both the Harvard study and Dr. Fauci? Do you have concerns that this is reopening Rhode Island too soon?
Yeah, I don't. If I did, I wouldn't be doing it. But it's a balance. So, you know, right now, Rhode Island is the first state in the Northeast. I'm the first governor to have lifted our stay-at-home order. So it is a fact that we're going ahead of Massachusetts, ahead of Connecticut, ahead of some of our neighbors. I made that decision because we had 14 days of a plateau, our hospitalizations were going down, our testing is the highest per capita of either any state in America, certainly any state in the Northeast. And our experience here on the ground is such that I felt it was safe to go ahead and do this. There's also a balance. You know, there's a relationship between economic health and physical health, and it is not healthy to keep so many Rhode Islanders out of work for so long. So in light of all of that, I made the decision, difficult decision, to lift the stay-at-home order with the focus on getting people back to work, but I kept the social gathering limit at 5. What I am concerned about is if we go too quickly. So I feel that we are in a good place right now, and if everyone continues to follow the rules and we go slowly, slow and steadily, walking before we run, whatever analogy you like, keep your social network small, limit your engagement with other people, follow the rules, put a toe in the water for these next 2 weeks while we get some actual lived experience to see, is Rhode Island ready to continue the reopening, I think is appropriate, and I'm not overly concerned. I wouldn't have done it if I were.
Governor, with that said, a lot of restaurant owners are expressing...
If I can follow up on that, what gives you confidence you won't have to step back and pull back and reimpose restrictions?
Yeah. So, right, as I said last week, I feel I am governing from a position of confidence in the people of Rhode Island. I have watched Rhode Island adapt and be flexible for the past 2 months, and by and large, people are following the rules. You know, this weekend we checked on a few hundred businesses. 95% of the employees in those businesses were wearing their masks. We think about 75% of customers were wearing masks. By the way, 75% isn't good enough. It's got to be 100%. If you go out, you're going shopping, fine, great, go out, spend money, help the economy, wear a mask. It's very simple, it's easy to do. By and large, people have been following the rules. We were out all weekend looking at the parks. I realized the weather wasn't great, but there weren't big congregations. Folks are not trying to sneak into nursing homes as we once saw that they were. So we are looking every day. We're out observing. Are people paying attention? And at the moment, the behavior of Rhode Islanders, it's like people get it. People get it. Breaking the rules only hurts you and your family. Breaking the rules only means we have to go slower to reopen this economy. So as long as we see that people are following the rules, we'll get more and more confident that we could continue to put the foot on the gas and open more.
Governor, with the announcement yesterday that you're going to open outdoor seating at restaurants, you know, we're hearing from restaurant owners they're still concerned these restrictions. A lot of them won't be able to open. They don't have outdoor space. They're concerned about the limit on tables, the reservation system. What do you say to those people who still think they may go under even with this opening?
So here's what I say. First of all, my heart really goes out to them. If you look, and it isn't just in Rhode Island, it's all over the country. If you look at certain industries, retail, restaurants, hospitality, hotels, tourism-dependent businesses, it's devastating. There's no way to sugarcoat it. I talk to these people, Stefan talks to them. It is very tough. So what I tell them is we're doing the best we can. If we relax these guidelines too much too quickly, it's going to be worse for them, because then it'll take even longer to get back up and running. I am sure the right thing to do is to go slowly. But, you know, the question Kate asked, you ask all the experts, going slowly is absolutely the right way to go. It doesn't make it easy. If I were them, I'd be frustrated too. It's tough. They've been out of work for a long time. So what I'm trying to do is do everything I can to help them earn a little more money. You know, this weekend we allowed restaurants to also do takeout for mixed drinks. It's a tiny thing, but we've heard from them it actually helped. Outdoor dining is another tiny step, and I hope it helps some of them. We are working really hard. I hope to be able to have an announcement in the next week or so providing small business relief using some of our coronavirus relief fund to target the smallest businesses and industries that have been most hit. So we're going to do everything we can to give them support, to tide them over. I hope some of them do outdoor dining, and I hope it's just a matter of weeks before they're back doing indoor dining. As it relates to the reservation system, the plexiglass, the hand washing, that we just have to get used to. I know it's a drag. I know it's more expensive. It's what we have to do. It's going to be here to stay for probably a year, so the sooner you figure out how to do it, the better off we're all going to be.
Bill?
Governor, I conducted a poll in the last 24 hours of hundreds of Rhode Islanders and found that 84% say they will not go to a restaurant even with outdoor dining during phase one, whether it's because they feel it's an unsafe situation for themselves or for workers. What do you say to the consumer here in the state?
Yeah. So you put your finger on something that we're going to have to work through. I just referenced today hospitals. You know, Nicole and I are in very close contact with hospitals, obviously. And they are saying, hey, you know, Gov, we are ready. We've worked for weeks. We are ready. We are confident. We are physicians. We wouldn't be doing this if we weren't totally confident we could take care of people. But patients are afraid. And so what I say to them is, I hear that. I understand that. You've been locked in your house for 2 months. This is a scary thing. This virus is very serious. I hear that. But I also will say it's time to be brave. It is time to start coming out again, slowly, carefully, with the new rules. So my birthday's Sunday. I told my family, take me out for dinner next week. Like, I plan to go out. I'm going to try to lead and show. It's, you know, I'm following my own rules, right? I wear my mask. I do this. I'm not saying it's safe for you to go out. It's safe for all of us to go out. It's going to take some time. That's the other reason I want to go slow. We have to build confidence. The other thing is, if you start to break the rules, and a lot more people get sick, then people will really not have confidence. That is the other reason to go slowly. So I would say, I hear you. I know you're afraid. I believe it is safe. I'm going to eat my own cooking, so to speak, and I would encourage you to slowly get out there and follow these rules. And after you do it a few times, I think you'll be confident.
Clarify what exactly, when you say if a lot of people get sick, we might have to roll back. What's a lot of people? What number?
Thursday. I'm going to talk about that on Thursday. I'm going to give a detail of when I think we can move from phase 1 to phase 2, and when I think we can, what kind of a surge we would see, which would cause us to have to go backwards.
Governor, I asked you several weeks ago about layoffs for state workers, potentially furloughs. Since then, Pennsylvania stopped paying 9,000 employees. Yeah. Your friend Eric Garcetti has said for Los Angeles city employees, 26 days between now and the end of 2020. So with an $800 million projected deficit now. And just as an aside, somebody else asked you, well, what about the JCLS? What about the legislature? You said that's their deal. The Speaker's office tells me they are following your lead. So, and with all due respect to Director Smiley, who answered it last time, I'd like to hear from you.
Yeah. No, look, it's a fair question. With an $800 million deficit, it is hard to see how we get out of this without doing furloughs. So I hear that. What I've been trying to do is not contribute to the state's unemployment rate, and also use as many state employees as possible in aid of the crisis. So what does that mean? You know, now we have contact tracers. I think we're up to 125 contact tracers, plus or minus, over 100. I'm trying to push state employees to help us with that work. There's data analysis to be done. So what we're trying to do is take state employees who are otherwise not fully engaged and put them in aid of the crisis so that they can help us with our work. Having said that, we just have started the work of looking at our budget in earnest now that we know how big the hole is. And I would love to avoid furloughs and layoffs, but I don't see how we're going to be able to do that.
Isn't the reality also that you do come out financially ahead? You talked about adding people to unemployment, but that only pays a portion of their salary. Ultimately, and now with this whole $600 that the feds are kicking in, I mean, every other state has said this is inevitable, and Rhode Island hasn't taken any moves toward that yet.
I wouldn't say that. Not every other state has already done furloughs. I think many have, some have. I don't think it's every. I don't even think it's most. But it's something we have to look at. You know, you're right. I have to find money. Hey, by the way, this budget's going to be brutal. I don't know where we're going to find $800 million. Everyone's going to be unhappy. Everything is on the table. Everything. You asked about JCLF. Everything is on the table. You can't fill an $800 million hole. And also, we're going to have to think very differently. You also can't just do traditional cuts. There's going to have to be some reorganization around it. I will say this. I am continually told by our federal delegation, by the Trump administration, by the Vice President, by the Secretary of the Treasury, that there's very likely to be another stimulus package to help states with exactly this problem. And they tell us we're going to have a lot more guidance in 2 to 3 weeks, last week of May. So I am holding out for that.
Fill the hole this year, then what's 2022 look like? I mean, that's the one-time fix that Rhode Island's been using.
Yeah,
long
fair
before
enough.
you were in office.
You can't do it with one-time fixes. I said that already. It's a huge hole. It's going to be a lot of challenges, and there's going to have to be some structural changes. Having said that, it's very hard, if not impossible, to do a budget today when the federal government might make you know, the last stimulus was $1 trillion. We received $1.25 billion. So, you know, if I'm going to get $500 million in federal aid to fill the budget, it's going to be a very different budget than if we get nothing. And I'm told that that's 2 to 3 weeks away. So we're just putting the plans in place. But to answer your question about furloughs, I don't see a way that we can get through it without it.
Governor, you mentioned the $8.2 million in additional hazard pay for some workers. Mm-hmm. Is that all new money, or is that some of the money you had promised previously a couple weeks ago?
No, that's all the money we promised. That's from the COVID relief fund. I'm sorry, I was just giving, that's not a new announcement. That's a fund that I rolled out 2 weeks ago. It's called the Congregate Care Workforce Stabilization Fund. We rolled it out 2 weeks ago. I'm just reporting today that it's been implemented, and that money is on its way out the door.
Governor, good afternoon. I want to just stay with the restaurant theme for a moment because it seems to be what everyone is talking about. Mm-hmm. And they're questioning, and here's some of the things, real specific things they're saying. Mm-hmm. Why 20 tables? If someone has the room, why not more than 20 tables? Why 8 feet apart instead of just 6 feet apart? Yeah. You also have prominent restaurants, Capriccio, Old Canteen, strictly inside dining. A restaurant owner said, why not give us a fighting chance to spread the tables out, because many of them are saying, like Griswold's Tavern that was written about in the Wall Street Journal, that are just saying this formula will not work. So why not let us open now and have a fighting chance?
So here's what I'd say to that. Recognize there is no one right answer. You know, yesterday Governor Baker came out with the beginning of what their guidance is. Every governor is doing it the same but a little different. So is there a magic around 8 feet? No. Here's what we know. Every public health expert says 6 feet because they know from studies how 6 feet is safe. So we said 8 feet because there's room between tables. There might be a server who's in between 2 tables. We just thought for ease of administration, if the tables were 8 feet apart, people would always be 6 feet apart because you have to get up from your table, maybe you have to go to the restroom, the whole thing. We're not ready for in-room dining. We are not, look, I am the first state. Massachusetts and Connecticut aren't even doing outdoor dining or any, they still have their stay-at-home orders in place. We are not now ready to safely open in-room dining. So the choice isn't in-room dining or outdoor dining. The choice is outdoor dining or nothing. And we just felt, my whole theory here is slow and steady, let some people get back to work if they can. And when we're ready for in-room dining, we'll go to in-room dining. And by the way, I think it's weeks, not months. So the outdoor dining is just, it's a little bit like allowing mixed drinks. It isn't perfect. It's a little more money to help tide you over for a couple more weeks until we can get to the business of in-room dining. And based on everything I know and all the experts I listen to and the shape of our curve, I feel that's the safest approach. And to the question somebody asked about confidence, the last thing we want to do is open too quickly, let the restaurants fill up, lots of people get sick, and confidence goes down. So it is frustrating, to be sure. If I were them, if I were those restaurants, I'd be complaining too. I get the frustration. I'm not faced with any good choices, and I'm doing the best I can, and I think that it's not safe right now to do indoor dining.
Quick follow-up on that. Reservations, is it practical? We're riding along, we want to stop and get coffee at the butcher shop. And
for now, it's what it is. I'm not saying forever, I'm saying for now.
And what about the limit of 5? It's a family of 6. Should one person wait in the car? How would that...
Try to follow the rules. Right, I'm saying try to follow the rules. That's all I'm saying. Just try to follow the rules. Don't try to ask what if and push the rules. And look, common sense, at some level, I said this a week ago, I am not going to be able to, nor do I want to be in the business of, legislating and tracking every move everybody makes. You should know by now what the rules are, and you should try your hardest to follow them, because it'll make your life, your family's life, and your business's lives better.
Governor, to follow up on the questions that came up in some of your remarks about further federal stimulus that will go to the states, the national press is considerably less optimistic, I think, than you've been. The New York Times reported this morning that the negotiations on the next stimulus are essentially a deadlock, and the possibility is strong in the view of a number of members of Congress who spoke to the Times that there may not be another stimulus that could be agreed to, or that any stimulus that came through would have very onerous restrictions on the use of the money by the states. For example, not being able to make up revenue shortfalls. And I know you're in regular communication with this federal delegation from Rhode Island, and they've given you assurances that they are more optimistic, but I'm concerned about the increasing divergence between the national press and that information.
I can only, listen, it's Congress. It's a challenge to predict. It is political, and we're talking about a lot of money. I can only tell you what I know. Right? I am not a member of Congress. I am not in Washington. Thankfully, I am here in Rhode Island and serving the people of Rhode Island. So I'm just telling you what they continue to tell me. This isn't a red state, blue state thing. I hear from red state governors every day whose budgets are a mess. To the question earlier about furloughs, you see in Ohio, struggling and beginning furloughs. There's not a state in America whose budget hasn't had a big hole blown through it on account of this crisis. And it is my firmly held view that the Congress has to do something to step up to meet the needs of the American people by providing an additional stimulus to states. Now, will it have strings attached? Almost certainly. Will there be restrictions on what we can spend the money on? I would have no doubt. Will, through a negotiation and the sausage making, it be less than we need? Probably. But I'm fighting for it, because we need it. And if, God forbid, it gets to a place where we don't get any more, then we will balance the budget. But I'm just telling you, here in this state, those consequences will be quite devastating.
Governor, we're hearing from some workers on unemployment who have had their benefits stopped or maybe their account frozen. Have you heard anything about that, or anything in terms of accounts having to do with the fraud investigation people can't get through. Can you elaborate on that and what you can tell these people who may be experiencing now difficulty even after they had started to receive benefits?
Yes, so I would say they should call DLT. It's hard for me to know the exact details, but we have there is, as you know, speculation that we have had some fraud. By the way, it's not just in Rhode Island, it's a handful of other states. And so we have had to freeze some of these accounts until we figure out the extent of the fraud. Having said that, what we're trying to do is reach out to people as quickly as we can, because we don't want to freeze the accounts of people who have a valid claim. So all I can say is we're doing our best, and if you know specific people, like literally send them our way, because we're trying to seek out people who deserve it. But in trying to stop the bleed and stopping money going to fraudulent people, we have frozen some accounts.
Following up on Brian's question here, so some are saying that they haven't received the check in 8 weeks. I mean, is there some kind of...
That is strange.
That's what we heard. I mean, we heard
the
that,
only thing I can think. So let me say this: the average time we are paying, on average, in about 10 days. Longer for some. Some of the PUA, not to get into the weeds, but if it's traditional unemployment insurance, it should be getting to you within 10, 11, 12 days. If you're applying for the PUA and you are someone like a waitress or a hairdresser or self-employed person, that should be getting out pretty quickly. If it's a more complicated request for PUA, so you haven't lost your job, but your doctor says you can't work, we are putting those through tougher scrutiny, and so those are taking longer. The other reason it could be delayed is if the information you gave us is incorrect. So the problem where we're seeing the most delays, incorrect Social Security number, lack of information, misinformation, those take longer. But if you're getting us all your information, if all your information is accurate and it's kind of a cut and dried case, we should be getting the money out to you in 10, 11, 12 days. So anyone, again, reach out to me directly, reach out to DLT. In general, every time we've checked into these cases that are taking a long time, there's something going on. Like there's something going on. They didn't give us the right information, it's inconsistencies, they're not eligible, it's taking longer to figure out their eligibility.
And just a quick follow-up. As far as these unemployment claims are concerned, do you have any kind of projections on what percentage of these jobs are just going to be permanently lost?
We don't. You know, I talked yesterday to the Secretary of Labor, and he said to me that they recently did a survey, and they were finding that the vast majority of people, they talked to people, felt that they would eventually, their job loss was temporary. So, which is very different from, say, 2008, 2009, when you did similar surveys. The majority of people thought their loss wasn't temporary. And that is here's how I think about it. We're trying to study this. Most people will get their job back. This is temporary. The restaurants, right? We're just talking about restaurants. They will reopen. Some won't make it, which is tragic. Most will. They will reopen. They will get their jobs back. The people I worry most about and who we have to figure out a solution for are people in low-wage, low-skill positions in industries that were already declining. Brick-and-mortar retail, for example. I worry a lot about that. You saw J. Crew went bankrupt. This COVID crisis is accelerating so many of the really difficult trends that we saw in our economy already. And so we got to be there for those people to help them get a new job and get some new skills, because those are the ones that I worry most about. But I think for most people, they will get their job back, and we hope pretty quickly. Kim had her hand up a long time.
Just a quick two-part question. Can you say how many of the fatalities today were associated with nursing homes or congregate care? And also, we got some new data on cities and towns by cases by city and town. And we're seeing some spikes in East Providence, Johnston, West Warwick. Do you believe that that's associated just with nursing homes, or are those cities seeing more cases in the general public?
So thank you for that. In terms of the nursing home data, for the unfortunate fatalities, approximately 340 of our fatalities are associated with long-term care facilities or assisted living facilities. There have been between 5 and 10 fatalities associated with other congregate settings. And of the 14 fatalities we announced today, 13 were associated with long-term care facilities. To really finish on that point before going to your second point, this is not about the facilities itself. Similar to what I shared, where the Department of Health has been doing all of the infection control steps, and because of access to the community and engagement, we tend to see this. So we want to make sure that we are continuing to support our nursing homes. The governor shared, for example, that FEMA is going to be delivering personal protective equipment. For the nursing homes, there's going to be 1 week in May and 1 week in June that they are aware of that they'll be receiving the PPE. So it's helpful for them to know that that's how it will be coming through. So the effort that we're doing, completing the cyclical testing and starting again, being as comprehensive as we can, is the key for everyone to be aware of and to know that there are people in nursing homes who are doing well, who are being cared for effectively. That's an important message to make sure we continue to emphasize. In terms of the cities and being able to understand the data for Central Falls, for all of the cities, Providence, we are reviewing that on a regular basis to help understand what is the percent positive, how are our communities at highest risk being impacted. I'll finish with echoing what the governor said. The work prior to this, particularly with our Health Equity Zones initiative, to really establish an infrastructure that can be in place in our communities disproportionately impacted to address all forms of health. That includes their health care, but it also includes access to fresh fruits and vegetables, access to quality education that we're all working hard to provide, access to adequate transportation and housing. That's really the comprehensive picture that we're looking for with the infrastructure that Health Equity Zones have put in place to establish, so that we can now leverage those infrastructures, invest in the public health support, invest in the education and the access to transportation and housing that's needed, and help the communities disproportionately impacted now have what they need to respond effectively to this crisis. As we're expanding testing and bringing in those services and support, leveraging the infrastructure we want to continue to invest in, that's how we're seeing those increased cases. We want to identify that and get them into the quarantine and isolation and the support that they need, so that we can make sure, as we're going forward, it's having all communities in Rhode Island have the infrastructure in place to ensure equity and to make sure that there aren't any repeat waves that are occurring. Because if it happens in one community, it's happening throughout all of Rhode Island, and that's why it's key to make sure the investment is equitably distributed, leveraging infrastructures that we've worked hard to put in place at the community level.